An increase in local cases of COVID-19 accelerating just days before the Thanksgiving holiday. Here to answer your questions is Dr. Helen Boucher, the interim dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Dr. Boucher, always great to have you.
Nice to see you, Erica.
All right, Dr. Boucher, you know I follow these numbers pretty closely. We started to see them rise about a month ago after a decline. It was slow at first, maybe 5–10%. Now, though, it's picking up pace. Yesterday, a 30% rise compared to a week ago. Today, 32% rise. Where are these increases coming from, and are you seeing any patterns in the data?
Yeah, well, Ben, we're seeing household clusters. So likely scenario, people letting their guard down at home. And kind of the usual type of transmission. The other thing to keep in mind is that there's a lot of use of home antigen tests, and there was a problem with one of those tests called the Ellume causing a lot of false positives. So we need to keep our eyes on this, of course, but also look at things like hospitalizations and other kind of harder numbers as we try to interpret the data.
Yeah, it seems like those are on the rise as well, unfortunately, at this point. Health officials have been warning us about a winter surge as weather gets colder, people move indoors. Do you think that's what's happening here? Are you ready to call it a surge even?
Yeah, well, you know, I think we're kind of at a level we were at back in October, so I wouldn't necessarily call this a surge. I think it's a bump and definitely worthy of our very close attention. I think it could be related to the cold weather. It could still be a late kind of Halloween effect. It's predominantly in non-vaccinated individuals, so the messages are the same, right? Fresh air, mitigation measures, and vaccination for anyone who hasn't been vaccinated yet.
All right, is there anything in these numbers that makes you think maybe families should stay home again for Thanksgiving instead of traveling? We know that kids certainly will not be fully vaccinated by next Thursday. So what's your advice for families?
Yeah, I think it's a really good question, and I think everyone has to determine the level of risk they're willing to take. Vaccinated individuals really are safe to travel and to gather. So I think thinking about who's going to be present, who might be vulnerable, and then what measures you can add in terms of layers of safety if you're in a situation where not everyone's vaccinated or you have vulnerable individuals. So in those settings, I would think about things like mask, distancing, sort of all the things that we know about. And again, outside is better than inside, and ventilation is very important, even indoors.
Well, so this is a question about an outdoor event. We learned today New York City, it's opening Times Square for New Year's Eve for that famous ball drop. You do need to bring proof of vaccination to get in. We also know New York City, they're allowing boosters for more people, and there's word that maybe later this week that will be in effect for the rest of us as well. So do you think that's a safe compromise given they'll be outside?
Well, I think vaccination, again, just to stress, vaccinated individuals can do things more safely. Right, not 100% safely, but much more safely. So I think that's a very good policy, and this is an outdoor event, so the risk is lower overall. And then if you have only vaccinated individuals participating, that will help mitigate the risk. Of course, everyone still has to decide the level of risk they're willing to entertain.
All right, Dr. Helen Boucher, interim dean at Tufts Medical School. Thank you so much for your time.
Thank you, Dr.
Thank
Boucher.
you.